Hello, everyone. So, my name is Drew Jester, and I'm doing a career project on licensed clinical social workers, and the acronym for that is LCSW. I'll be using that a lot during the video, so I want to make sure you guys are aware of what that is and what that means. So, as a licensed clinical social worker, you are doing social work, but you do have uh, basically counseling under your license. So some of the things you would do as a professional would be therapy services for individuals, groups, or couples. You are able to assess patients, diagnose patients, and provide treatment plans. A large percentage of the work you would do as a licensed clinical social worker is providing education to the public and providing advocacy for mental health services. Now, I was able to do an interview with a LCSW. Her name is Veronica Arnold. She works at CAPS, which is a counseling center at Clayton State University, um, and she works there as a licensed clinical social worker. But on the counseling, she does more counseling than anything. Within her role, she's also able to supervise students working towards obtaining the same licensure. She also is an outreach coordinator at the school, so she hosts different events pertaining to suicide prevention, sexual assault, and abuse, and just collaborating with other um, students on the campus about mental health and seeking help. The day-to-day schedule for a licensed clinical social worker at Clayton State is doing about 4 to 6 appointments of individual therapy, supervising interns, and doing outreach activities. The good thing about working at the school is you have a pretty much a set schedule outside of any extracurricular activities you decide to do. So that's working 8 a.m. to 5 p.m. weekly, and then, anything you do in addition, like outreach programs, that's overtime or in addition to. Some of the different locations you can work as a licensed professional counselor would be, I would say, like a hospital. You're able to work. At universities and schools. You're able to work at government agencies, private practices. You can do nonprofit organizations, community centers, hospitals, assisted living facilities, and then you also can work from home. So a lot of people don't know that, but you can work from home. Um, let's see what else we wanna go over. So, in order to obtain your license, there are a series of steps that you have to follow to a certain point. So, you want to start with obtaining your bachelor's degree. Most people get it in social work, but you do have the option to get one in a related field like psychology, sociology, or counseling. So, you want to get that bachelor's degree in one of those, and then you want to go ahead and apply to an accredited master's program. A little tidbit, you want to make sure the program offers a CSWE accreditation, which is Council on Social Work. Um, as you're doing that and you complete that master's program, you do have to have a certain amount of clinical hours, which is a minimum 3,000. They do have to be supervised by a clinical professional that has the license that you're trying to obtain. So you have to do those, and that can take about 3 years to complete the full hours in court and getting your experience as a clinical licensed clinical social worker. You also, after you complete that, you want to go ahead and apply to take your test. And that test is going to be through ASWB, Association of Social Work Boards. And then in some states, you'll have to do the jurisprudence exam. So you have to check with your state to make sure that that is something that you have to take as well in order to get that licensure. Once you complete that, you're able to practice independently or work as a licensed clinical social worker. On the exam, it's not as many questions as people think. It's a lot, but it's not that many. So it's approximately like 170 questions, and then it's approximately $260 to take the exam. That is each time until you pass it. Okay, so that's important to know. You also want to check within your state to see if your license is reciprocal, meaning that it transfers state to state, or you hey, you got it in Michigan, but you can use it in Georgia, kind of thing. That's something that I feel like is very important. When I interviewed Miss Arnold about the route she took, she went to graduate school in Missouri and she now works in Georgia, so that reciprocal license. She took the LMSW exam, so that's like the Masters for Social Work. That's a required test in the state. She had to do supervision for 3 years and obtain 3,000 hours, and then she obtained the LCSW licensure in 2014. She did have to do once a week supervision with someone with the same licensure, um, but it worked out for her. And now she's been able to work for Albany State University. She now works for Clayton State University. Like it's a lot of different things that come with that licensure and being able to work under that license. I also wanted to get information on the profession as a whole. Is it a growing profession? Is it a shrinking profession? So I'm well equipped to know what's going on. So as of now, LCSW is a growing profession. There's always going to be room for it going forward. It's a growing opportunity because people will always need support. People will always need mental health. People will always need social service programs and just different help. So that's definitely a growing profession. As of now, there's going to be about 74,000 jobs opening annually, and that's between now and 2031. So there's great room for growth. Great room for growth. The expected salary as the LCSW coming out is about 68,000. If you were just a social worker, it's lower, it's like 40,000. But again, that's a master's or a bachelor's working under a bachelor's as opposed to having your LCSW license. And then of course, your pay and your amount that you're making annually will increase with your experience and your time. So that's an important tidbit to know. A lot of people want to know the pros and the cons related to working in the capacity of a licensed clinical social worker. And there are pros and there are cons. So, some of the benefits, I would say the main benefits to doing this would be your values and your morals. This has to be something that you are passionate at, you are passionate advocacy, you want to help people, you want to make a difference, whether it's small, whether it's big, or whether you're okay with it being over time. But you're creating awareness and you're shining a light on mental health as a whole. Unfortunately, the drawbacks of this position is there's a lot of burnout, meaning that you get tired, you get stressed, you get overworked, and that can happen. Unfortunately, that happens to a lot of people within the first 5 years. So that's a thing. And then on top of that, it's the job stability. So when you have that licensure, you're always able to find a new job, but it's the fact of staying within that current position for a certain amount of time, especially if you're working for a governmental organization or you're working for a nonprofit organization, because those type of positions are generated by grants from the government. So, say if the grants aren't coming through or you don't get approved for that grant, then now you have to look for another position. So, those are, that can be a whole thing, especially since, licensed clinical professional social workers are low paid and they're undervalued. People, I feel like the psychological services as a whole isn't completely mature yet, so they're not there in reference to understanding the worth of these professionals and how much they should be making. But it has increased over time, so there's much more to go. I was able to ask my interviewee the question of, if you had to redo everything, what would you do? She basically stated that, if she had to redo her situation and possibly pursue something else, it would still be in healthcare, it would still be with advocacy, and it would still be mental health, more so along the lines of working as a nurse in a mental health clinic or in a rehabilitation facility. Those are some of the tidbits she threw out there. I think it's very important to always look at your career path and what you're trying to pursue and make sure there's room to venture out, room for growth. In reference to career testing, I feel like career path is probably within my top three ranks, mainly because who I am as a person. I like to help people. I like to generate change. I want to be there for people, and I feel like this is a career path where you can help people that really need help, and you can feel good about yourself, and you're putting something into your community. So, in reference to career testing, after I've completed my research on licensed clinical social workers, I would say it's still a top contender. I still consider doing it. I just haven't made my final decision, so I have a little bit of time left, but definitely consider it. Overall, the licensed clinical social worker, I feel like is a great field to go in. And if you have any additional questions, just let me know.